good morning. My name is Maren. I'm going to be your nurse today. I'm here to perform a head-to-toe assessment. Can you tell me your name and date of birth?
My name is Jane Doe, and my date of birth is July 14th, 1969.
All right, great. Thank you so much. Can you tell me where you are located today?
Where am I located? I'm at the doctor's office.
Okay, and can you tell me what year it is?
It is 2023.
And who is the president right now?
It is Joe Biden.
And what are we doing today again?
You're doing a head-to-toe assessment.
Great, thank you. So I can tell that the patient is alert and oriented ×4, and that her general hygiene is clean, she's well kept, her hair is tidy and her nails are cut, there's no obvious deformities, she's not in any acute distress at the moment, facial features are symmetric. And do you have any allergies?
No, I don't think so.
Okay, and are you in any pain?
No, I'm not.
Alright, I'm going to start with inspecting and palpating your scalp.
Okay.
So I'm going to just feel around, and no lumps, bumps, no lesions that I can tell, no dandruff or pests, and thank you. I'm going to move on to the temporal arteries and your temporal mandibular joint. Can you open and shut your jaw for me? Ooh. Does that usually pop?
Sometimes.
And can you clench your teeth for me? Does that cause you any pain?
No.
Okay, alright, thank you. Alright, do you mind smiling for me with your teeth? Frowning? Alright, raise your eyebrows for me. Thank you. Can you shut your eyes? Alright, thank you. Can you puff out your cheeks like that and suck them in? And then can you feel on your cheeks there? Okay, thank you. Okay, great. And then next I'm going to inspect your eyes. So externally the lid isn't puffy, the conjunctiva is pink, and the sclera is white. The eyes are symmetrical, and there's no obvious signs of deformities. So I'm going to start by looking. Pupils were round and reactive to light, equal and accommodating. Can you follow my pen light for me, please? Thank you. I'm going to bring it in. Thank you. I know, thank you very much. So next I'm going to look at the external ear. I'll go this way. So the pinna is clean, no obvious signs of redness or irritation, no drainage noted. Does that cause you any pain?
No.
The ears are symmetrical on her, and no pain.
No.
I'm gonna look internally, and no signs of drainage or obstructions noted. I'm gonna whisper something in one ear and occlude the other. Can you just tell me what I say back to you?
Apple, banana. Cat, dog.
Okay, thank you. And then next I'm going to move on to her nose. So externally again, facial features are symmetrical and skin condition is good, no redness, no irritation, no drainage noted. I'm going to use my light. So septum is midline, no deviations. I'm going to ask you, if you don't mind, can you smell my hand sanitizer?
Yes.
Okay. So I'm able to smell fine. And then I'm just going to occlude, plug one nostril, and tell me you can breathe out the other. Right, thank you. So, excuse me, next I'm going to move on to your neck and palpating your lymph nodes here. Tell me if this causes you any pain or discomfort. I don't feel any swelling. Yeah. Okay, great. And then I am going to use my light again and look in the patient's mouth. Do you mind saying ah for me?
Ah.
Thank you. So mucous membranes are pink, the tongue is pink and moist, teeth are intact, the uvula is midline and it doesn't appear swollen or inflamed. And then can you please stick your tongue out and move it side to side for me? Thank you. It's testing cranial nerve number 12. And then if I had a tongue depressor, I would test the gag reflex using that. So next, visually looking at the neck, skin, no appearance of lesions or redness. I'm going to palpate here, no swelling. Trachea is midline. Can you swallowing for me, please? Thank you. And then I'm going to palpate individually the carotid artery. And those are +2 bilaterally. Can you raise your shoulders against my arms for me? Thank you. Those are equal resistance. And I'm going to, before I move on, just listen to your carotid artery. Strong, and no bruise noted, so no problems there. I've been watching your breathing and I've noted that your shoulders rise and fall symmetrically with inspiration and expiration, no heaves or palpitations noted. I'm going to move over to your back, if it's okay. And you see me. I'm just gonna press over your long field.
Mm-hmm.
And does this cause you any tenderness or pain?
No, it doesn't.
Thank you. And there we go. I'm going to listen to your breath sounds. If you don't mind just breathing normally, taking deep breaths as you can. Thank you. Okay. Moving back up to the chest, I'm just going to check for skin elasticity, pressing the clavicle. Skin elasticity is normal, no tenting present. Excuse me. And then I'm going to also listen to your breath sounds in the front if you don't mind. Thank you. Breath sounds are normal bilaterally, no adventitious breath sounds heard. Thank you very much. Next, I'm going to move on and take note. No jugular vein distension on either side. I'm going to, if I was to palpate for the apical pulse, I would go to the midclavicular line right here and go down to the fifth intercostal space. So I am going to take the apical pulse at that site. So I'm going to listen for a full minute for just a moment, okay?
Mm-hmm.
Okay, so that was 66 beats per minute. Pulse was strong and heartbeat was normal, no murmurs or S1 and S2 sounds were present. So next I'm going to listen to the 5 heart sounds. If you just give me one moment.
Mm-hmm.
Thank you. So I'm going to start with the aortic and move on to the pulmonic. Going now to the tricuspid. And to Ebb's point. Sorry. Down to aortic. I'm going to do that again with the other side, if you don't mind. Okay, thank you very much. Woo! Alright, so going forward, I'm going to palpate your brachial pulse, which supports your arms right here. Yeah. Okay, thank you. Pulses are strong. Oh, sorry, I'm gonna go to the second capillary refill time. 3 seconds. 2 seconds, so that's perfectly normal. You're warm, your skin is pink, undertones, so the skin looks good. Next I'm going to move to the abdomen. So start with inspecting the abdomen. It's symmetrical, it's not distended or concaved. It doesn't appear to have any
Muscle tone.
muscle. Not what I was gonna say, but thank you. So next I'm gonna listen to all 4 quadrants to see if vowel sounds are present. Bowel sounds are present, all were present. I'm gonna just slightly go like this. And then does this, do you have any pain
No
or
pain.
tenderness in your abdomen? No signs of lumps or bloating. So going forward, I'm going to palpate the popliteal pulse, which is behind the knees. But I just want to show you again. Okay. Thank you. Your feet are cold. Thank you. Pulses are strong. No edema is noted on the patient's ankles. And then I'm going to just ask if you don't mind, I'm going to assess your muscle strength. So give some resistance against my hands forward and then pull back. Thank you. Can you flex your feet up towards my hands and then back down? Thank you. Equal resistance. We're going to do the same with your upper body. So can you push your hands up towards me? Yep. And then back down. Thank you. And then same movements with your forearms. Push down, please. And then flip. Flip your arms over and then up. All right. Thank you. Equal strength. If I had a reflex hammer, now would be when I would use it to assess reflexes in the bicep and the tricep, here at the elbow area, and then also here at the knee. You can assess for the plantar reflex of the foot. I'm going to ask if you don't mind standing for me, please. And then we're just going to put our feet together, hands together, and this is the Romberg test, so this assesses for balance, and you would want to stand close to your patient to be sure they're not going to fall. I would also ask my patient to walk normally across the room to assess gait. You can sit back down for the moment, thank you. And then walk heel to toe across the room, and then also on their toes. And then lastly, I guess I shouldn't have had you sit down.
That's okay.
Stand up for me
That's
and just slightly bend forward. And I would just assess the patient's spine lightly. No pain, no swelling noted. Spine, thank you very much, is even and doesn't appear to have any curvature. So that would conclude our head to toe assessment. Thank you very much. Do you have any other questions or concerns today?
No, I'm sure you would have told me if there's something you would have found.
All right, thank you very much.
Thank you.